Dr. Loya, can you please describe what are fibromyalgia and chronic fatigue syndrome?
Fibromyalgia and chronic fatigue syndrome are disorders that are triggered by stress in the body. And fibromyalgia is on one end of the spectrum, chronic fatigue is on the other end of the spectrum. Patients with fibromyalgia typically have more pain as their major symptom, although they still suffer from fatigue, from impaired concentration and difficulty focusing, word finding, what we call brain fog. In addition, they suffer from poor sleep. Chronic fatigue syndrome patients, or really it's called chronic fatigue and immune dysfunction syndrome, may also have aching muscle pain, but really their bigger problem is fatigue. And some of those patients don't even have pain. But both conditions are characterized by the difficulties with concentration and impaired thinking, poor sleep, so that many patients have either trouble falling asleep or staying asleep, and even those who do sleep 10 hours, 12 hours, 14 hours, awaken and feel like they haven't slept at all. So that sleep is non-restorative and non-refreshing. There are strict criteria by which the American College of Rheumatology has developed a way of diagnosing fibromyalgia, and the CDC for chronic fatigue syndrome. However, those definitions tend to exclude a lot of patients who are suffering from these disorders. So really any patient who has fatigue and pain, unrefreshing sleep, and that they have exertional fatigue that's not relieved by rest probably falls into one of these categories and could benefit from treatment.
And can you describe some of the treatments that you employ?
Some of the treatments that we prescribe or recommend here in my office include things that focus on all of the underlying disorders that are going on in the body. So someone may be a normal, highly functioning person going along in their life and work, handling multiple stressors at a time. And finally there's a stressor, whether it's psychological or physical, an infection, illness, injury, accident, surgery, and it's the straw that breaks the camel's back and tips them over into a cascade of disorders in the body. And these disorders are at the level of the cells in the body. So every system in the body is affected. We see the immune system affected, where people cannot either fight off infections and they're susceptible to more infections, or can't get rid of infections. Or sometimes we see reactivating viruses, fungus, bacteria for things that they had been exposed to years ago. In addition, the stress works through the adrenal glands and the hypothalamus, which is the control center of the brain, to cause the hormones to be out of balance. Not in great ways that are easily identified by testing, but symptomatically, and mild suboptimal levels that we see can sometimes be treated by giving those human identical or bioidentical hormones, whether it's thyroid, adrenal support, estrogens, progesterones, to bring someone's body back into balance so that it's functioning more normally. For those patients with immune system dysfunction, there are supplements, both orally and injectable treatments that we can do to help boost immunity and balance out the dysfunction of the immune system. In addition, some of the other treatments focus symptomatically on things like sleep and pain. And again, I'm an integrative physician, so I use a combination of supplements, regular prescription medication, IVs, oral treatment, injections to help alleviate those symptoms until we can correct more of the underlying dysfunctions in the body. All of these abnormalities, the hormonal imbalances, the immune system issues, the sleep disorder, all of those affect how well the body or the cells in the body can make energy. And the energy that the body makes is called ATP. That's like our gas, our electricity, however you want to think of it. And that fuel comes from little power plants that are in every cell of our body. And those power plants are called mitochondria. All of the other disorders that we talked about, the sleep disorder, the immune system dysfunction, allowing reactivating infections, the hormone imbalances, as well as possible nutritional deficits, both from dietary deficits as well as problems with absorption within the gut. All of those things impair those power plants' ability to make energy in our body. So really at base, my treatment of fibromyalgia is focused at restoring that power, flipping that circuit breaker back on and restoring energy production at the level of the cells in the body, so that every other area of the body can start to function more normally again, and those symptoms can be under control.